According to an article by the Jason Foundation, more teenagers and young adults die from suicide than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, chronic lung disease combined. The escalating mental health crisis is an issue that needs immediate attention and action. And by implementing a school-based mental health program, it is not just a policy option, it is a necessity to ensure early action, equitable access to care, and lasting emotional well-being for our youth. The mental health crisis is something that needs immediate action, and we can implement policies and programs that can save the lives of so many children in the United States and in the whole entire world. So many teens and children struggle and suffer from mental health and illnesses, and I personally have had a family member die from suicide. My cousin, who was only 13 years old, committed suicide in September of 2020. His name was Andrew, and he suffered from leukemia at only 2 years old. And because he was having to take so many medications and having to experience so much chemotherapy at such a young age, it affected his brain and the way he thinks, which down the line, as the years went by, he began to suffer from mental illnesses. This is him. This did happen during COVID-19, and according to a study by the National Institute of Mental Health, the researchers identified 5,568 youth who died by suicide during the first 10 months of the pandemic, which was higher than the expected number of deaths had the pandemic not occurred. He did attend therapy weekly, but the negative stigma that surrounds mental health facilities is why his parents did not want to send him there. And unfortunately, he couldn't receive all the help that he needed, which is why I feel so passionate and persuasive about this topic. There are so many mental illnesses that affect our youth in our world today. The World Health Organization listed off several of the conditions, which are emotional disorders, behavioral disorders, eating disorders, psychosis, suicide and self-harm, and risk-taking behaviors. Some children are at a greater risk to these illnesses and conditions because of living conditions, stigma, discrimination or exclusion, or lack of access to support and services. There are way too many children that suffer on a day-to-day basis, which is why the mental health crisis is so important to pay attention to. In fact, nearly 20% of children and young people ages 3 to 17 in the United States have a mental, emotional, developmental, or behavioral disorder, and suicidal behaviors among high school students increased more than 40% in the decade before 2019. These mental illnesses in children and teens are going unnoticed, and when they are noticed, it's way too late, and we are losing so many lives daily to these illnesses. This is a call to action. These children and teens are crying for help, which is why it is so important and our responsibility to respond. This shows a brain that suffers from lots of mental illnesses. This mental health crisis needs immediate action. This has been overlooked for so many years, which is why it needs so much attention from the people in our world today. I believe we can help solve this crisis by implementing a school-based mental health program. I believe this addresses the crisis because, according to the National Library of Medicine, the majority of children and youth spend a considerable amount of time in schools, making schools an ideal environment to provide timely and convenient access to mental health services, including early identification, prevention, and interventions to prevent the escalation of mental illnesses. These programs provide easy, accessible support to so many children and teens attending school on a day-to-day basis, especially the people who cannot afford to send their child to a facility, a program, or care outside of school. Although schools do normally have school counselors, This mental health program will be way more beneficial and provide so much more care to the children and teens that need it today. These programs would provide and promote equity to the underserved communities and reduce the negative stigma around mental health in our world today. These programs provide tools and supports to the children that suffer from mental illnesses and could save so many lives. Personally, I have had a family member die from mental illnesses, and I am aware of all the mental illnesses and conditions that children suffer from, which is why I believe we need to implement policies and programs in our schools today to help save the lives of children and teens. The escalating mental health crisis in teens and children is an issue that needs immediate action, and implementing a school-based mental health program is not just a policy option, it is a necessity to ensure early action, equitable access to care, and lasting emotional well-being for our youth. The mental health crisis is a large problem that needs everyone's attention, and these policies and programs could save the lives of so many teens and children. If you or someone you know is struggling, please reach out and get the help you need or call 988, the Suicide and Crisis Hotline, to get help.